Welcome back to Houston Life. Vein disease affects more people than you might think, and many don't even realize it could be the reason they're feeling uncomfortable or seeing changes in their legs.
Yeah, Mel Camp visited Reincke Vein Center in Sugar Land to learn what causes vein disease and how patients are finding relief.
We've all heard it. Aches, swelling, tired legs, they're just all part of getting older, right? Well, maybe not.
I just thought it was like, I'm working too much. I'm like sitting down too much. I'm not exercising enough, right? So after doing a little bit more research on Dr. Reincke's website, I said, well, maybe this is something that applies to me.
For years when I've traveled, I get swelling in my ankles and my feet. And so I started wearing compression socks to try and, fix that or abate that. But this last December when I traveled, the swelling came on and it never went away.
Just understanding it's not normal, but this isn't just a normal part of aging. One of the things that's a big focus, certainly for our team, is education and outreach. So you may not know necessarily that the swelling in your legs, aching, itching, skin discoloration is vein disease. But what you know is that it's not normal, or that it's starting to interfere with things you want to do in your daily life. You suddenly notice that you used to be able to stand to cook or do cleaning or perform your job, and now the time that you're able to stand is less and less because your legs are getting swollen or your feet hurt, etc. So I think understanding how it affects patients' quality of life and their activities of daily living, just understanding that those might be symptoms of an underlying issue.
At Reincke Vein Center in Sugar Land, Dr. Tonie Reincke and her team help patients understand what's really happening beneath the surface and shows them that relief is possible.
Vein disease is a genetic predisposition to having stretched out veins with valves, kind of like little doors inside the veins. They don't close. So when the vein stretches, it pulls those valves apart, and blood that normally should be going through the valves, and the valves close immediately, because the valves are stretched out, blood's going backwards. Gravity is pulling that blood. The blood that should be going towards your heart is now backing up. It's going towards your feet. What's the issue? What's the problem with that? The problem is it creates a high pressure in your skin that over 10, 20, 30 years, that pressure starts to build up. It gets very high, and having that high pressure in your skin causes inflammation. So it releases a message, your brain releases chemicals, those are inflammatory chemicals, and then you start to develop symptoms. So vein disease is big veins with backward blood flow that ultimately lead to symptoms.
What's the treatment process like?
The beautiful thing is there's no downtime with the procedures. So patients will have a procedure. I treat one vein for each visit, and it's a heat-based procedure done with ultrasound, numbing medication, a catheter, which is like a flexible straw. We heat and seal those veins that aren't working for the patient and contributing to their symptoms. And those patients, that takes me maybe 15 minutes. It's a very efficient procedure. That patient walks out of the office, they're back to their normal activities the same day.
I went back to work. I, went pick up my daughter, go to the gym. I'm so happy. I'm grateful to have found her, and I'm grateful to have come here. Just come in here, get a free consultation.
Treatment is really accessible for people. Like, it is covered with most insurance.
Correct. Medicare, Medicaid, most commercial insurance will approve the procedures that I perform for medically necessary procedures. We help with that, so it's not something that's left onto the patient, that onus. If a patient calls in, my receptionist can speak with the patient, find out their insurance information, and then let them know before they even come in the door, thumbs up, thumbs down, your insurance covers it. Overwhelmingly though, yes, insurance covers it.
For Dr. Reincke, it all comes down to connection.
Good morning, Mr. Keller.
She takes time with every patient, listening, explaining, and guiding them through care that feels personal every step of the way.
It's my passion. I want to see the patients. I want to provide care from start to finish. So I see them from their very first interaction here when they come in for an evaluation. And then the patient and I discuss treatment options, but I am also the one that's doing the procedures from start to finish. 100% of all of their visits, I see them. So I don't know, maybe I'm just like a greedy doctor that just wants 100% of their time, but I love that.
We've been together for close to 3 months now, on and off, every week, every other week to do all of the different treatments that are needed. So it's been good. If you are having quality of life issues, your feet are hurting, your ankles are hurting, your legs are itching, you noticed swelling, why not come in and find out, is this vein disease that's causing this in my life? And if it's quality of life, improve your life. Don't wait.
And Dr. Reincke is offering a free consultation for Houston Life viewers. Just call 281-394-4446, or you can go online at ReinckeVeinCenter.com and just mention you heard it on Houston Life.